We welcome everyone to this regular news conference we hold to try to get the facts out about the coronavirus impact here in Greenville. As has been said throughout this sequencing of these news conferences, I guess we've had about 7 of them or something like that with some of the local experts. This is to try to break away, if you will, from the national news story that you see on television all the time about what's happening in New York or Texas, wherever else, and try to localize it. Try to let people have a chance to see what's happening in their neighborhood in Greenville, South Carolina. That's why we're here, to hear the facts. We also do have a representative from DHEC for the state perspective. But while we have the state news, we've found over the past several weeks that sometimes the state news and the local news is not exactly the same on this. So this will be an interesting discussion to find out more about what's happening in South Carolina and compare and contrast that to what's happening in the Greenville area. I want to mention up front, just in terms of the city, there's a lot going on in the news right now. This country is going through a lot, and people are expressing their views very, very passionately with George Floyd's murder. And so there's a lot going on, and people have come into the streets and protested. But we also have this issue to deal with. And some people have asked, well, where's the local government been, or where's the hospital system been for the last 2 weeks in terms of these numbers we're hearing? And the truth is, it's hard to get a message out. There's a lot going on out there, a lot of things to put people's attention on. So we decided very intentionally not to do anything last week. We thought we'd wait a while, and that's why we're here today. We're going to try to get some messaging out. It's not that we haven't been on it. We have been on it. We know people are not social distancing as they should. I am guilty myself of not social distancing as I should. That's a very prevalent situation. It is not unique to Greenville. My goodness, if you go to Columbia, Charleston, or Chattanooga, or Houston, Texas, you'll find the same thing. I don't think we're unique, but we're all guilty of this. So we need to be reminded again how important this is. And I think we need to be reminded that the steps to be taken at this point, especially compared to what we had to do in the last several months, the steps to be taken going forward are really an easy ask. An easy ask, and I think that our physician friends will talk about that. It's still back to washing hands. For goodness sakes, it's back to social distancing, being mindful of social distancing. And again, a lot going on, and we're going to try again to remind people in the coming days and weeks in downtown Greenville and everywhere in Greenville how important it is. We're going to keep reminding. So we'll talk a little bit about that. I think, let's see, Beth, do I have these comments on the screen? I put some comments on, just for some background. I'm getting a lot of emails. I'm sure all elected officials are. I can only imagine how many the governor gets. We have a representative county council here, Mr. Enos Fanning. I'm sure you get a lot too. Some people with different views, but overwhelmingly we get a lot of these comments like this. Thank you for being so concerned about our numbers, who have spiked for coronavirus. So many people refuse to social distance, and many say they don't want to wear a mask. I'm disappointed in people's concerns for others. I know in my heart that we reopen too soon. And then I have messages by the truckload like this. These are actual emails. We would like to add our voices to those of other citizens expressing concern over the general lack of face mask and social distancing in downtown Greenville. Again, it would really be everywhere. The situation is particularly concerning and possibly a cause for the designation of Greenville County as a hot spot. Well, suffice to say, we all know this is the case. We all know that people have really gotten lax about social distancing. And again, what's being asked is just not that great. It's just not that great in the scheme of things, because we don't want to go back to where we were earlier. So we'll have some opportunity again to talk a little bit more about that. But first we're going to talk about the facts, kind of where we are. This is not a moment to scare people, but it sure is a matter to get people's attention. And that's really why we're here. So up first will be Dr. Brandon Traxler, who we see a lot these days on television and such. We appreciate your